My name is Rosie Simonee. I am from Panhandle, Nunavut. I moved to Ottawa 2012 to work for Ottawa Health Services Network as a medical interpreter. As an interpreter, we meet the patients who come from Nunavut. Here in Ottawa, we meet them at the hospitals for their appointments. For those who don't need interpreter, we also are there for them for moral support. Or even when they speak English, they have hard time understanding medical terms. Yes, and with other cancers like colon or other cancers too, but we see a lot of lung cancers patients. They can be here up to 3 months just waiting for appointments for testing. After the test, they have to find out now what type or what it is exactly the lung cancer. After that, then they need treatment. Treatment can be up to 3 months without going home. With government of Nunavut, there is a policy that if a patient has an escort, it has to be who speaks English. Biggest problem is for a patient who is already having hard time being away from home, being away from their used to surroundings. If a patient is an elder, most of the time they have to look for an escort that speaks English. So with that, they just look for someone, not that who they are used to, or their wife or husband that can take good care of them mentally and physically, because it has to be someone who speaks English. It might be someone who they don't even live with back home, at their home, and because they are not used to each other, it can be more stressful for a patient too, because some are afraid of because they don't know them, they don't know what they do, and when they can't really help for moral support. I know few people that have refused treatment just because they want to go home, because they already have been here a long time, and some they just want to go home and be with their family to the end. All of cancer patients, their diet has to change, like no spicy food, or foods have to change, and at Larga it never changed. There are a lot of things like main are caribou meat, Arctic char, seal meat. Seal meat is very good for nutritious, like it's good for everything because it's rich meat. And elders with lung cancer or any elder, when they are sick, they start craving for something that they haven't got in a long time, like H. walrus meat or ptarmigan. In the perfect world, would be good to have, for them to have country food available all the time, because some lung cancer patients, the way some do it too is before they have their chemo, if they have their own country food, they eat that before the chemo so their body can be stronger. I think it would improve a lot too if they have moral support who is working that speaks their language and have time for the patient, for lung cancer patient, just so they can express how they are feeling or what's going through their mind, because of when they have to have escort that and don't really do moral support. It would be good for them to have that someone available. And when they are at the hospital, the medical interpreters are already too busy with appointments, so sometimes they don't see interpreter the whole time they are admitted at the hospital, only when it is requested. That too, with no mental health or anyone that is just supported to lung cancer patients, there is no one available to do that. And if they are able to express about their feelings or stress, that can help a lot. Or if they need more support in like where they can go, or what do they need more in Ottawa, would be very helpful if someone could speak for them. I know it's very hard for patients when they are diagnosed with lung cancer, because it takes a long time for them to be investigated. By the time they are diagnosed, they can't do anything anymore, so they are just sent home with no treatment. And it would be very good if they have someone working just for lung cancer and other cancer patients, to have someone available focusing just on that. Someone who can interpret and be mental health worker.
Well, Rosie, thank you very much.
Thank
so
you.
much.